Hello everyone, and I am Amita from Nourish Doc, a platform for natural and holistic therapies. We will be talking about stress management with Gua Sha. We've been talking about stress management, a lot of sessions by yoga, by pranayama, by mental exercises, a lot of different things. But today's topic is very different. I don't know how many of you really understand what Gua Sha means or Gua Sha is. So Dr. Paige Yang will be joining me from Hawaii live. So and you can ask all the questions from her. What exactly is Gua Sha? It's a Chinese scraping device. If you don't know about it, and she will be I'm just looking at when she's joining me so that I can she can start talking about all the details, and any questions you have you can ask as usual in your chat window, and then I don't know, do you know if Gua Sha is like a sort of like it's a scraping kind of a, not like a device, scraping kind of a thing that you can do on your body, then helps your better blood flow or circulation. That's what I understand. If anyone else knows what Gua Sha is. And a lot of Chinese medicine practitioners, when you go to them for any of the treatments, I've gotten it done because I had my shoulder pain, and then basically what they do is they use it for scraping your body for better circulation. So Dr. Paige should be joining me in 1 second. There you are. Hello, how are you?
Hi. Sorry, my other account, I wasn't able to join the live, so I just jumped on here.
Okay, I was trying my best to make users understand what Gua Sha is. So, but thank you so much for joining. Maybe you can introduce yourself before we get into all the questions.
Yes. So I'm Dr. Paige Yang. I'm a doctor of acupuncture and traditional Chinese medicine. I have two practices, one in the Bay Area, one here in my hometown in Hawaii. And I specialize in women's health, which includes fertility, hormonal health, mental health, as well as facial rejuvenation. And I also have a traditional Chinese facial tool line called Yang Face that launched this past summer. So, yeah.
Wow, that's amazing. That's amazing. So let's understand, before we go to the facial part, which I think a lot of people want to understand the facial part, but let's understand what Gua Sha is on a higher level.
Okay, great question. So first we'll just start with the actual word, right? Gua Sha. So Gua and Gua Sha, that means to scrape. Wow. And scrape or sweep, we sometimes use it, it's often used as a verb. It can also be a noun. And then Sha is referring to the petechiae, which is the red dots that form when you do the scraping. And actually this, if you study Chinese characters, you're going to see a radical for disease in this Sha. And then underneath that radical is this character for sand. So what we see is there is disease present in this kind of sand-like texture. So this is referring to that petechiae that happens from the scraping. And Gua Sha is traditionally used on the body to relieve internal illness. So typical symptoms may be fever, catching colds, heat stroke, body aches and body pains. These were all things that were typically, where Gua Sha was typically indicated for in the past, and still is today in China and in TCM clinics and households in East Asia.
No, you're right. In fact, I had a shoulder pain a few months back, and I went to and I've been going to an acupuncturist regularly. And she used Gua Sha on my shoulder and a lot of things, and it really helps. And I was like, oh my God. She started scraping here and there, and you don't know because so that brings us to the next thing about the research. Maybe is there any research on this particular technique?
Yes. So there's a lot of research. If you speak Mandarin and you understand Chinese, you can find a whole plethora of research. if you're an English speaker and reader and writer, there thankfully are also studies. I would say, gosh, over 100 or so that have
Wow.
been done on the effects of Gua Sha. And it looks particularly at myalgia or body ache and body pain, but there is a nice body of research.
That's amazing. That's amazing. I think a lot of people, I mean, I see a lot of articles on the internet, but I don't think most the end users don't still understand what Gua Sha is.
Right. And I can talk about some of the research. So
Sure, please.
yeah. So in the studies that have been done in Europe and in Asia, I'm sure there has also been some stateside. What they're really looking at is they're looking at this perfusion unit. So the perfusion unit is measuring the blood flow per unit time per unit mass. So in other words, it's just seeing the volume increase of blood to the area that Gua Sha is applied to. So in these studies, they'll do Gua Sha to a local area, meaning a direct area of interest.
Yeah.
And then they'll use a laser Doppler to take a look at the blood volume in that area. And in these studies, they have found the volume to increase 2 to 4 times in a very short amount of time. So that means more blood is going to that tissue over the course of the treatment. And these treatments have been 15 to 25 minutes or so. And then what they've also found in these studies, which is amazing, is that the microcirculation or this blood volume increase also went to distal areas. So meaning areas that were outside of the local area of interest, where they saw another increase of blood flow. And in these studies where they were able to measure the blood flow, the perfusion unit over time, many of the participants found that their body aches and pains decreased significantly and also got them to the next treatment. In other words, lasted more than just the time of the treatment, but even maybe definitely a day later up to a week later that they were having relief from that session. So, and most of the body of research on Gua Sha is looking at pain. So neck pain, upper back pain, lower back pain, and that's really where it's traditionally applied anyway. So that's where the bulk of the body of research is going to be looking at.
So I mean, most of us are working from home right now, and all these things that you talk about, the neck pain or the back pain, you know, not that we are having serious problems, but most of us are experiencing something or the other, you know, like neck pain. So Gua Sha would be an amazing tool. So let's come to the facial part of the Gua Sha now. This is really interesting for a lot of women, especially.
Yes.
So let's talk about that and how you got into the facial part of the Gua Sha.
Okay, yeah, this is near and dear to my heart because I am my mother's Chinese, my grandmother's from China, and this is something that I really was raised with, Chinese medicine and the practices within the medicine and culture. So facial Gua Sha or Gua Sha applied to the face for cosmetic benefits has gained a ton of popularity recently in the West. And something that I've had a hard time with is the way that it's been marketed and advertised. I feel like they'll use words like newly discovered or newly reinvented. And which of course couldn't be farther from the truth, right? Because this practice has been around since the Paleolithic age in China to ward off the disease. And then it became really popular in the 17th century, the Qing dynasty, when there was an empress. And she applied these, she repurposed these tools using precious stones and applied it to her face for the cosmetic benefits. So that really developed that type of a practice. When it made its way to the US, you know, when it started to say, oh, it was accidentally discovered or there's this new thing, it's been really a disservice to the culture, the rich culture and history that it comes from. So essentially what it is we're taking that same type of stroke that was used when we scrape the body and we're applying it to the face, but in a much more gentle manner.
Mm-hmm.
And this is, like we mentioned, giving, improving the microcirculation
Mm-hmm.
in the subcutaneous level, so underneath the skin.
Mm-hmm.
And that is where people are getting these nice cosmetic benefits from.
Got it. Got it. So what is the material that they use? Do you have something with you that you can show?
Let me, I normally, oh, I should have like had something right next to me.
Okay.
Oh, I do have something right here.
Okay. Because I think it'll be helpful for people to see what it looks like. I mean, I've seen
Yeah.
it, you know, I've read it so much in the internet. I don't own it, but I
Yeah.
keep on buying it, and then you know, yeah. Let's see what the material is. What kind of material do they use?
So my line, it's so cute. This is a little sneak peek because I'm developing like a miniature
Oh,
line.
okay.
But
Okay.
this is a really small version
Oh,
of,
yeah.
yeah. And this is rose quartz.
Yeah.
So you can use most materials. I personally chose rose quartz because the darker gemstones are really coveted and they kind of come with some conflict as a result, like ethically. And quartz is so abundant, it's really found anywhere in the world. So there isn't a lot of this kind of quote unquote blood diamond, blood trail attached to rose quartz.
Okay.
The other thing is some stones really hold the energy of who it's gone through in the production process.
Oh,
And yeah, so rose quartz is actually one of those that does not attach as much to people's energies as it goes through their hands before it gets to the owner.
mm-hmm.
And it's great for like self-love, and of course this is a self-care practice, so it's something that I really like. But anyway, this is the
Okay. So how do you
question.
just let's just do a small demo if
Ah,
you don't mind.
yeah, oh my gosh, this is such a great question. So
Yeah.
I like to open up the chest, which kind of I'll come underneath the clavicle, and
Okay.
you want to have the tool really flush against the skin, so parallel.
Okay.
I'll show it on my cheek because it's going to be easier to see for everyone.
Okay.
So you want to get it as flushed to the skin as possible.
Okay.
And then from here, you'll just slowly bring it up. And you can go upward and outward to the hairline.
Okay.
And then, so if we did it on the chest,
Yeah.
then same thing. You're going to be flush against the skin and you're going to go outward.
Oh, got it.
Yeah. And then actually so I like to start down here, and then I'll make my way to the neck, and I'll go in the back, and you can actually stroke downward for the neck.
Okay.
And same thing, you're just going to be flush downward like this, and you can bring it down past the clavicle. But this is going to help to open up all of the channels and meridians.
Wow.
Yeah, which is wonderful because there's so many on the face. Most of them relate to the digestive system, actually, which is really interesting because people can understand from their own experience that their diet will influence their face and their appearance.
Yeah.
So in Chinese medicine, this is completely in line with the meridians and the channels, where a lot of the GI channels are going to be on the face. Anyway, so I think a lot of people believe that they need to be very aggressive to get a certain result, because they want to like sculpt or they want to depuff and lift. The truth is, when you go very strong on the face, in order to protect itself, the body's the lymphatic system and the circulatory system, they're going to contract in order to protect your face and your skin. Because it's almost like a micro trauma or an injury when you go too hard. So the most effective way is to actually have very light pressure and slow intentional strokes.
Just go like that a little bit. Yeah. Okay.
Yeah. And this is what's going to get you the best results instead of really trying to work it. And that's something that I see a lot with non-licensed practitioners. Is I see them making videos and they're just like really going at the faces. Yeah, and that technique is more for the body, right?
Oh, I see. Yeah, because body is more stronger. Like the skin is thicker. It's not, it's not like so soft, right?
Right. And when we do that technique on the body, we're trying to release the internal heat. Yeah. When we do this gentle technique on the face, we're actually trying to increase some heat. right?
Got it.
Both are increased in circulation, but one's going to be better indicated for the other. So that is typically the technique.
Mm-hmm.
And something else I would love to share with everyone, because I see this happen. Two more things.
Mm-hmm.
One is I often see the technique where people are holding the tool perpendicular like this.
Oh,
And that's not really, that's not going to give you the best result for
okay.
a couple reasons. One is in traditional Chinese medicine, we're really trying to work in harmony with
Okay.
our channels and meridians. We're not trying to be in opposition. So when you do it like this, it can cut through those channels and meridians. Whereas when you do it like this, it kind of like coexists with them, right? And it
Got it.
nicely stimulates them. So that's another thing. The last thing, I know I'm so passionate about this, so I'm
No,
like
it's
talking
great.
more.
It's good. How
Yeah.
do you do it on the forehead?
Oh,
So
okay, the forehead.
here you do
So
like this. Here you
yeah.
do like this, and nose and forehead and chin. How do you do that?
Okay, so forehead, I see, sorry, this light here. So forehead, there's a couple things you can do. So one is just like this on the midline outward.
Yeah.
And a lot of times I like to, even though I say midline, I'll maybe go a little bit on the other side so I don't miss any part of it.
Yeah. Yeah.
Another thing you can do is actually hold your hairline. I'm holding the phone with my other hand, but you can
Yeah.
hold your hairline and you can go upward.
Got it. Got it.
You
Got it.
can even go downward because the muscles that create these lines on the forehead, it's from the muscle going up.
Mm-hmm.
So you can also go gently downward, securing the hairline here.
Yeah. Yeah.
And then the nose is often forgotten, but you can either just come, I like to go on the side of it for my
Okay.
patients like that.
Yeah. Yeah.
The chin, same thing, kind of midline. And then I like to often like use a curved end and rock it over here.
Okay.
Underneath the chin, I'll rock it too over the lips. And then I'll do like a finishing stroke. So yeah, I mean, there's of course going to be a lot more like advanced techniques involved that practitioners will be able to perform on their patients. But for the most part, that's kind of the general routine of it. And patients find it very relaxing. So,
And this is self-care. This is, I mean, this is like we can do it at home, right?
yes, absolutely. And these strokes, the way that when you practice it, when you perform it correctly, it really taps into that parasympathetic nervous system, that rest and digest, and kind of shelves the sympathetic nervous system a little bit, right? And tells the body that it can relax. And it's a great stress reliever. The endorphins will be released as well.
Yeah.
It helps with muscle tension. It gives more hydration to the fascia. So it's really just a great practice for stress and, like you just said, self-care.
Amazing, amazing. So one more question. You see a lot of derma rollers, you know, that they have little pins or micro pins, right? And those are more Western, right? So, they also, I think, talk about a similar concept is what I'm thinking. But how do you compare that kind of a device, what they call derma roller, with the little pins to Gua Sha?
Yeah.
Okay. Someone is asking a question. They're saying, what kind of pressure is used?
Yeah, very light pressure. Very light
gentle
pressure.
And light.
Yeah, in fact, I also tell people if they're unsure what that means, just use the stone as your pressure. So the weight of the stone will be the pressure that is given, right? Just this weight alone. But that derma roller question is great because it's kind of a mixed, there are mixed feelings about it in my field. So some acupuncturists really like it. They'll include it in their treatments. They find that it helps with scar tissue. They find that it helps break up acne scars. It brings a lot more circulation. I personally feel like it tears the dermis. And I think that it tears it to a point where it can't really repair in enough time. So I actually believe that over time, it's going to make the skin a little bit thin and raw, and it breaks apart the tissues more than I'm comfortable with, basically. But yeah, it's kind of like everyone has a different opinion on that, and
Of course.
some say one and some say the other. But I have found, and maybe because I'm in a tropical climate, that it thins out my patient's skin rather than rebuilds it and repairs it. Yeah.
Great. No, I think this is amazing. This is, anyone has any questions or feedback? We are talking about, I see a slew of people joining at a later time, but just to summarize, we are talking specifically today about facial gua sha. I don't know if people know what gua sha means. We did talk about it at the beginning, but you can watch the recording. But if someone has any question or feedback, you're welcome to, type it in the comment, and we'll take care of that. Anything else you would like to add, Dr. Page?
Yeah, I'd say lastly, and this is an important message as well. I've just been seeing a lot of mainstream beauty and wellness brands that are disconnected to traditional Chinese medicine market this as like a Botox alternative.
Oh my God.
And I feel like they are really missing the mark because they're kind of selling you on this idea that something's wrong with you, right? And that you need this to improve. And and then it's also kind of telling you that, the marketing, they'll say like, erase this wrinkle or like depuff this area. And I think it's completely fine to be seeking that. I never want anyone to feel judged, but I don't love it when the brands use this tactic to sell. And the real intention behind this practice is actually embracing everything. It's not erasing, it's embracing. So the minute you start to, like I said, when we're talking about this perpendicular technique, when you stop being in opposition with yourself and start embracing yourself and everything that makes you uniquely beautiful, the great thing about that is the aesthetic benefits actually increase exponentially. Yeah. But when you have to come at it from a different road instead of trying to like erase yourself. If you are just really lovingly embracing yourself, you will find the results are much better and you no longer have to fight. And this is what I think is important for people to understand the true essence of this practice. And that nothing is wrong with you. So you never have to grab outside of yourself to feel like whole and complete. This is just a way to reinforce what is already uniquely yours and connect with it. And then build a practice with it that you have love and compassion for yourself. So just something that I want everyone to know because I see the marketing out there and I'm like, oh my God. Yeah.
No, and the funny thing, it's really funny that they show all celebrities. I don't want to name anyone here in the show. And they show, acupuncture, facial acupuncture is the new Botox, and they show a picture of the face with all kind of needles on it, and I'm like, oh my God,
Yeah. So they have Botox is Botox and facial acupuncture is facial acupuncture, and they really yield a completely different result. And of course, I love what I do. So, but I don't provide Botox, and the people that do it have great skills and they can give women a lot of confidence too. So I don't like this either or kind of like going against one another. I don't think it's very productive for anyone, right? So I'm glad that you kind of had that impression too.
Yes. No, maybe facial acupuncture is another topic one day. Separate thing. Well, no, I think this is great. Absolutely amazing. The tool that you talked about, Gua Sha. Okay, someone is saying, I learned something this morning. Okay. So
nice.
Good. You learned something new. I hope that you learned something new because, this is a new, most of the Asians have beautiful skin, really, this is true. It is true.
I decided, I decided not to wear any face makeup today because I think it's just important that we all we kind of what's the word? We don't put too much, we just come as ourselves, right? I think that's important. Yeah. Destigmatize imperfections. Yeah.
That's beautifully said. I think that's beautifully said.
Mm-hmm.
Okay. Anything else? Any comments? We are going to wrap up now. Any comments? You're welcome to ask us later. I know a lot of people come and watch our shows from Asia, from UK, and of course in US as well. So let us know how we are doing. And yeah, thank you so much, Dr. Page, for joining us today. Facial acupuncture is another topic that we're bringing, and we'll also be bringing some cool wellness programs with Dr. Page and some of the tools and some of the products. So stay tuned with that. Thank you so much, Dr. Page, for being with us. Bye now.
Okay, thank you for having me. Take care.
Yes,
bye.